Hi, I'm Lucinda from Boston Medical Center, and today we're going to be talking about substance use and functionality among court-involved patients with mental illness. This study came from a clinical program at Boston Medical Center, the Boston Outpatient Assisted Treatment Program, which is modeled off of assisted outpatient treatment. Assisted outpatient treatment is a civil procedure providing court-ordered, community-based mental health treatment to individuals whose difficulty adhering to outpatient treatment voluntarily has led to repeated hospitalizations and incarceration. The Boston Outpatient Assisted Treatment Program is a modified, voluntary, criminal case-based AOT program that provides patients with serious mental illness, social, mental health, and substance use treatment to achieve recovery and avoid incarceration. To better understand the population of focus, we'll talk about the criteria to be involved in the BOAT program. There are two main criteria. The first is clinical, in that individuals must have a primary serious mental illness diagnosis. The second is legal, in that individuals with pending charges, they must have a pending charge through the Boston Municipal Court. There are two tracks for these charges. The first is pretrial untried matters, where individuals implement BOAT as a part of unresolved cases and conditions of release. The second trial is probation, where individuals with unresolved cases implement BOAT through probation. If both of these criteria are met, in that the individual has both a primary serious mental illness diagnosis and a pending charge with the Boston Municipal Court, the intake process can occur. The BOAT intake process starts with the case manager completing an evaluation. This includes risk and biopsychosocial assessments, where it's determined whether these clinical and legal criteria are met. Once it's determined that the patient is a fit for the program, a judicial hearing takes place where judicial approval for the patient in the program must be obtained. Once the patient is approved for the program through the judge, they're able to receive a full diagnostic interview and collaborate with providers to create a multidisciplinary treatment plan. Once this treatment plan is created, clients are able to interact with treatment, and this treatment is monitored by their case manager, and their compliance is communicated to the court or probation department, depending on which track they're involved in. And so within this population, we decided to focus on substance use disorders and alcohol use disorders because of the bidirectional relationship between serious mental illness and co-occurring substance use disorders. Individuals with SMI and co-occurring substance use and alcohol use disorders and criminal history have significantly higher risks of reincarceration, hospitalization, and attempted suicide. It is for this reason that our objective was to investigate the impact of substance use and alcohol use on physical and mental health functionality within a cohort of BOAT patients. We specifically decided to focus on functionality because this is an outpatient program, and the goal is to keep individuals in the community and functioning in the community. And so functionality is a big part of what makes patients successful in this program. As far as methods are concerned, we conducted a cross-sectional study within the BOAT program. The population we looked at consisted of individuals enrolled in the BOAT program with and without co-occurring substance use disorders and alcohol use disorders. For clinical assessments, between 2021 and 2023, we had 180 patients enroll in the BOAT program. Of these patients, about 85 completed the short form health survey. This is the measure that we used to decipher both physical and mental health T-scores, and so that's why we use this cohort. The ICD-10 was used to define disorders: alcohol use F10.1 through F10.99, opioid use F11.1 through 11.99, cannabis use F12.1 through 12.99, sedative use 13.1 through 13.99, cocaine use F14 through F14.1 through F14.99, and stimulant use being F15.1 through F15.99. We performed bivariate analysis to compare patients with SUD or AUD and those without SUD or AUD. To give some descriptors about our patients, the mean age was 35. We have a majority male population at 82.6%. As far as race is concerned, the majority of our population being Black or African American at 46.4%. For living conditions, most of our patients are living in owned or rented or other people's residences. And there's a significant portion being homeless, shelter street outdoors at 21.5%. Where education is concerned, the highest level of education received for the majority was 12th grade or a high school diploma, 35.4%, and then less than 12th grade being 23.1%. Finally, the majority of our population was unemployed at 72.3%. Now looking at figure 2, we'll talk a little bit about our findings. You'll see that about 15% of the cohort had alcohol use disorder, and the most prevalent or most common disorder amongst this cohort was about 27% for cannabis use disorder. All of these diagnoses totaled together gets a 52% of patients being diagnosed with either a substance use or alcohol use disorder. Moving to figure 3, we'll discuss the physical and mental health functioning scores. There's a statistically significant difference between the mean physical health T-scores of the group with alcohol use and or substance use disorder and those without alcohol use or substance disorder. Those without had about the US population average for mean physical health score. And then those with alcohol use or substance use disorder had a significantly lower T-score. As far as mental health functioning is concerned, both populations, those with and without alcohol use and substance use disorder, were significantly lower than the US population average, and still seeing that lesser functioning score for those with alcohol use disorder and substance use disorder. And so this was really the sum of our key findings. We concluded that the elevated rates of substance use disorder and alcohol use disorder had a negative impact on both patients' physical and mental health functionality. And for future directions, most importantly, this was used to indicate the continued need to provide recovery coaching, certified peer support specialists, and addiction-focused medication management to address the full scope of patient needs. We will perform multivariable regression analysis with functionality as the outcome moving forward. And we will also assess the differences in functionality scores among baseline, 6-month, and program discharge.